we have made towards the management of COVID-19 patients. I am delighted to announce that today we have surpassed the 100 mark for recovery of patients. In the last 24 hours, we have discharged 8 patients from our hospitals. This brings to 106 the total number of our recoveries. We have noted the number of recoveries steadily going up while fatalities have stagnated. In the last 1 week, the number of those who have died from COVID-19 have remained at 14. Within the same period, we have discharged 39 persons. This is an indication of the dedication of our healthcare workers. From the bottom of our hearts, we want to thank our medical and health workers for the role they have played in this fight. They remain our frontline soldiers, without whom fighting this war would be extremely difficult, if not impossible. I therefore want to appreciate all those organizations that recognized the critical role of healthcare workers and have come up with initiatives to care for and appreciate them. In this regard, I want to acknowledge Absa Bank Kenya PLC and Minet Kenya Insurance, who are now providing psychological support care to our health care workers and those in quarantine facilities, isolation centers, and their families. I wish to remind those who may be experiencing any psychosocial distress to reach out to them on this number for counseling and support. The number is *202*04#. I repeat again, for counseling support, you reach out to this number, *202*04#. Even as our health workers dedicate their time to manage our healthcare facilities, their efforts alone will not be enough in flattening the curve. It requires all of us to exercise our individual contributions by observing the various intervention measures we have continuously advocated and announced. I want to thank Kenyans for observing these measures. The achievements we have registered could not have been possible without everyone's cooperation. I want to thank our mamambogas, boda operators, matatu operators, the youth, the taxi drivers, local entrepreneurs, and many others for their contribution to this fight. However, even as we celebrate these achievements, we cannot afford to become complacent and lower our guard. We must stay focused and maintain the course. And I want to appeal to those Kenyans who may not be strictly following the directives to please do so. It's extremely important that we follow these directives because it is the only way that we will be able to interrupt the transmission cycle of the virus and register some level of success in bringing down the numbers. While at this, I would also like to urge counties to strengthen the multi-sectoral structures so that various sectors play their respective roles in responding to this pandemic. And I'm sure that Governor Kuti will talk to that when he comes to the podium. Communities should regularly be sensitized on infection prevention and control measures for COVID-19, including the role of nutrition in boosting the body's immune system and speeding recovery from illness. Early this month, the Ministry of Health released 2 guidelines, key nutrition messages to contribute to prevention of COVID-19, and the interim guidance for nutrition management of COVID-19 for health workers in treatment and isolation centers. These guidelines give recommendations of the foods we should consume to remain healthy, and therefore I urge county governments to make use of the guidelines and to disseminate the information to the communities.